ARDS NCLEX questions. Question 1. Which signs and symptoms distinguish hypoxemia from hypercapnic respiratory failure? Select all that apply. Cyanosis, tachypnea, morning headache, paradoxical breathing. Cyanosis, tachypnea, and paradoxical breathing are signs of hypoxemia. Morning headaches and pursed lip breathing are signs of hypercapnia. Question 2. Which of the following clients are at risk for developing acute respiratory distress syndrome? Select all that apply. A client who experienced a near drowning. A client following coronary artery bypass graft surgery. A client who has a hemoglobin of 15.1. A client who has dysphagia. Near drowning, chest trauma from surgery, and dysphagia with aspiration risk are risk factors for ARDS. A hemoglobin of 15.1 is normal. Question 3. What is an important consideration when selecting an oxygen delivery device for a patient with acute hypoxemic respiratory failure? Always start with non-invasive positive pressure ventilation. Apply a low-flow device such as a nasal cannula. Correct the arterial oxygen level to normal as quickly as possible. Base the selection on the patient's condition and amount of oxygen needed. Oxygen delivery should be tailored to the patient's specific clinical status and the required fraction of inspired oxygen. Question 4. What are the most common early manifestations of acute respiratory distress syndrome that a nurse may observe? Dyspnea and tachypnea, cyanosis and apprehension, respiratory distress and frothy sputum, bradycardia and increased work of breathing. Dyspnea and tachypnea are the most common early signs of ARDS. Question 5. Which interventions are used in managing a patient with acute respiratory distress syndrome? Select all that apply. Intravenous injection of surfactant, giving adequate analgesia and sedation, elevating the head of the bed 30 to 45 degrees, monitoring hemodynamic parameters and daily weights. Management includes sedation, analgesia, head of bed elevation, and hemodynamic monitoring. Surfactant injection is not a standard intervention and may cause complications. Question 6. Which intervention is most likely to prevent or limit ventilator in a patient with ARDS who is mechanically ventilated? Increasing positive end expiratory pressure, increasing the inspiratory flow rate, use of low tidal volume ventilation, suctioning the patient via endotracheal tube hourly. Using low tidal volumes of 4 to 8 milliliters per kilogram reduces mortality and the risk of ventilator. Question 7. A nurse is assessing the respiratory status of a client with a fractured rib. Which findings should the nurse expect? Slow and deep respirations, rapid and deep respirations, paradoxical respirations, pain, especially on inspiration. Rib fractures typically cause pain and tenderness that worsen with inspiration, leading to shallow breathing. Question 8. A patient is in acute respiratory distress syndrome from sepsis. Which measure should be implemented to maintain cardiac output? Administer intravenous crystalloid fluids. Place the patient on a strict fluid restriction. Position the patient in the Trendelenburg position. Perform chest physiotherapy and assist with staged coughing. Low cardiac output in ARDS may require crystalloid fluids, inotropes, or lowering PEEP levels. Question 9. A client with a chest injury has suffered flail chest. What is the most distinctive sign the nurse should assess for? Cyanosis, hypotension, paradoxical chest movement, dyspnea, especially on expiration. Flail chest results in paradoxical chest movement where the fractured segment pulls inward during inspiration and moves outward during expiration. Question 10. A patient with pulmonary fibrosis has hypoxemia during exercise but not at rest. Which physiologic mechanism is occurring? Diffusion limitation, intrapulmonary shunt, alveolar hypoventilation, ventilation-perfusion mismatch. Pulmonary fibrosis involves a thickened alveolar capillary interface that slows gas transport, making hypoxemia more likely during exercise. Question 11. A nurse is assessing a client with multiple trauma at risk for ARDS. What is the earliest sign the nurse should assess for? Bilateral wheezes, inspiratory crackles, intercostal retraction, increased respiratory rate. An increased respiratory rate is the earliest sign of ARDS, often appearing 1 to 96 hours after the initial insult. Question 12. What is the normal range for pulmonary artery wedge pressure, PAWP? 2 to 6 mmHg, 6 to 12 mmHg, 15 to 20 mmHg, 20 to 30 mmHg. The normal range for pulmonary artery wedge pressure is 6 to 12 mmHg. Question 13. Which statement best describes pulmonary artery wedge pressure, PAWP? A measurement of right atrial pressure. Reflects left ventricular end diastolic pressure under normal conditions. A measure of systemic vascular resistance. An indicator of right ventricular failure. PAWP is a measurement of pulmonary capillary pressure and reflects left ventricular end diastolic pressure under normal conditions. Question 14. What is the normal cardiac index range for an adult? 1.0 to 2.0 L/min/m2, 2.5 to 4.0 L/min/m2, 5.0 to 7.0 L/min/m2, 0.5 to 1.5 L/min/m2. The normal cardiac index range is 2.5 to 4.0 liters per minute per square meter. Question 15. How is the cardiac index defined in clinical practice? Cardiac output divided by body surface area. Stroke volume multiplied by heart rate. Mean arterial pressure minus central venous pressure. Systolic blood pressure minus diastolic blood pressure. Cardiac index is the cardiac output adjusted for the patient's body surface area. Question 16. A patient with ARDS on positive pressure ventilation has a cardiac index of 1.4 and a PAWP of 8. Which order should the nurse question? Increase PEEP from 10 to 15 cm H2O. Start a dobutamine infusion. Give 1 unit of packed red blood cells. Change the maintenance 4 rate from 75 to 125 ml/hr. High PEEP can decrease venous return and further lower cardiac output. Dobutamine, fluids, and blood cells help improve cardiac index. Question 17. When caring for an older adult with respiratory failure, which intervention should the nurse add to individualize care? Assess frequently for manifestations of delirium. Position the patient in the supine position primarily. Provide early endotracheal intubation. Delay activity and ambulation to provide healing time. Older adults are more prone to delirium and healthcare-associated infections during respiratory failure. Question 18. A nurse notes the cessation of inspiratory wheezing in a patient with acute asthma distress who hasn't received meds. What does this suggest? Spontaneous resolution of the asthma attack. Acute development of bilateral pleural effusions. Airway constriction requiring immediate intervention. Overworked intercostal muscles. The sudden absence of wheezing in a distressed patient, known as a silent chest, indicates severe airway obstruction and is a medical emergency. Question 19. Which patient would most benefit from non-invasive positive pressure ventilation to promote oxygenation? A patient with unstable cardiac output and blood pressure. A patient with cystic fibrosis producing copious secretions. A patient with respiratory failure due to a head injury with loss of consciousness. A patient with respiratory failure from the progression of myasthenia gravis. NIPV is most effective for respiratory failure caused by chest wall and neuromuscular diseases, but is contraindicated in hemodynamic instability or decreased consciousness. Question 20. Which medication is used to decrease pulmonary congestion and agitation in a patient with acute respiratory failure? Morphine, albuterol, azithromycin, methylprednisolone. Morphine helps reduce pulmonary congestion, anxiety, agitation, and pain in patients with heart-related respiratory failure. Question 21. ABG results show pH 7.31, PaCO 249, HCO 326, and PAO 252. Which order should the nurse complete first? Administer albuterol inhaler. Start oxygen at 2L/min by nasal cannula. Increase fluid intake to 2,500 ml per day. Perform chest physical therapy 4 times per day. The patient has respiratory acidosis and hypoxemia. Oxygen therapy is the priority to correct hypoxemia. Question 22. A patient with a barbiturate overdose has a respiratory rate of 8. The nurse recognizes the patient is at risk for which type of failure? Hypoxemic failure related to shunting. Hypoxemic failure because of diffusion limitation. Hypercapnic failure related to alveolar hypoventilation. Hypercapnic failure because of increased airway resistance. Barbiturates depress the respiratory center, leading to a decreased respiratory rate and alveolar hypoventilation, causing CO2 retention. Question 23. Which intervention should the nurse initiate to prevent stress ulcers in a patient with ARDS? Observe stools for frank bleeding. Maintain head of the bed elevation at 30 to 45 degrees. Begin enteral feedings as soon as bowel sounds are present. Administer prescribed lorazepam to reduce anxiety. Early enteral nutrition helps protect the gastrointestinal mucosa from damage and prevents stress ulcers. Question 24. A patient with aspiration pneumonia has a PAO2 of 42 on 80% FiO2. Which intervention should the nurse complete first? Stat portable chest radiography. Give lorazepam 1 mg for push. Place the patient in a prone position. Position the patient with arms supported away from the chest. The nurse should first position the patient to facilitate chest expansion and ventilation. The PAO2/FiO2 ratio indicates ARDS. Question 25. When caring for a patient with ARDS, which finding indicates that therapy is appropriate? Arterial pH is 7.32. PAO2 is greater than or equal to 60 mm Hg. PEEP of 20 caused blood pressure to fall to 80/40. No change in PAO2 when turned to prone position. The goal for ARDS therapy is a PAO2 of 60 mmHg or higher and maintenance of a normal pH. Question 26. An older adult has low PAO2 due to left-sided pneumonia. Which intervention helps the patient mobilize secretions? Augmented coughing or huff coughing. Positioning the patient side-lying on his left side. Frequent and aggressive nasopharyngeal suctioning. Application of non-invasive positive pressure ventilation. Augmented or huff coughing techniques aid in moving secretions. The patient should be positioned good lung down right side. Question 27. Which assessment findings are early indications that a patient with fractured ribs is developing respiratory failure? Tachycardia and pursed lip breathing, Kussmaul respirations and hypotension, frequent position changes and agitation, cyanosis and increased capillary refill time. Mental status changes, such as agitation, restlessness, and confusion, are early signs of inadequate brain oxygenation. Question 28. What does a low-pressure alarm on a mechanical ventilator indicate to the nurse? Excessive airway secretions, a leak within the ventilator's circuitry, decreased lung compliance, the client coughing or attempting to talk. Low-pressure alarms typically signify a leak or disconnection in the ventilator tubing or at the patient connection. Question 29. Which finding is a clinical manifestation of ARDS in a patient who reports dyspnea after aspirating? Tympanic temperature of 100.4, PAO2 of 50 mmHg after 100% oxygen administration. Rhonchi, hyponia. Refractory hypoxemia, where the PAO2 remains low despite high concentrations of supplemental oxygen, is a hallmark of ARDS. Question 30. A nurse is preparing to admit a client with myasthenia gravis. Which supply should be at the bedside? Metered dose inhaler, continuous passive motion machine, oral nasal suction equipment, external defibrillator pads. Patients with myasthenia gravis are at risk for aspiration due to weakened oropharyngeal muscles and require suction equipment. Question 31. A client in a motor vehicle crash has absent breath sounds, dyspnea, and tachycardia. What is the priority action? Obtain chest X-ray. Prepare for chest tube insertion. Administer oxygen via a high-flow mask. Initiate 4-access. Airway and oxygenation are the first priorities in an emergency assessment using the ABC framework. Question 32. What is the purpose of administering vecuronium to a client with ARDS? To treat infection, to facilitate ventilation, to decrease inflammation, to reduce anxiety. Vecuronium is a neuromuscular blocking agent used to paralyze the muscles, facilitating mechanical ventilation and reducing oxygen demand. Question 33. A patient is receiving vecuronium during mechanical ventilation. Which medications should the nurse anticipate administering? Select all that apply. Fentanyl, furosemide, midazolam, famotidine. Patients receiving neuromuscular blockers must also receive sedation and analgesia, such as midazolam and fentanyl, as they remain conscious and can feel pain.